Good afternoon from Austin, Texas. My name is Dale Correa, and I'm the Middle Eastern Studies Librarian and History Coordinator for the University of Texas Libraries. I am pleased to welcome you to the latest installment of the Digital Scholars in Practice series. This lecture series and also panel series highlights scholars conducting research through or on digital technologies and critically examining digital technologies in practice. It seeks to celebrate innovative scholarship and build a community of practice of digital scholars, both on the local and national scale. Today's DSiP, Digital Scholars in Practice event, is titled Data is Not Neutral, panel discussion. We will begin with presentations by both of our panelists, Amy LeClair and Kim O'Neill. Following the presentations, I'll lead the panelists in a guided discussion, and then we'll open the floor to questions. And so now I'd like to take the time to introduce our two panelists. Amy LeClair is a medical sociologist and associate professor at the Center for Health Equity Research at Tufts Medical Center in Boston. Her research focuses on using qualitative methods to understand and address barriers to care for minoritized populations. Currently, she is collaborating with clinicians in areas of breast cancer disparities, Hep C testing, and treatment in incarcerated populations, lupus, and primary care for sexual and gender minority populations. Kim O'Neill is an associate professor of English and Women's and Gender Studies at Quinnipiac University, where she teaches literature by migrants and BIPOC writers. Her current monograph in progress deploys and revises Latinx and hemispheric methodologies to frame a cultural history of the Cold War in the Americas. Her work appears in the Cambridge History of American Women's Literature, the Journal of American Studies, and Pedagogy. So we will begin with Amy. Please join me in welcoming both Amy and Kim. Thank you.
Hi, everyone. Thank you for having me here today. I'm really excited for this panel. I am going to talk about my work as a health services researcher and the types of data that we use in health services research. So just to start with a brief definition of terms, so we're all on the same page. When we talk about an EMR or an EHR, those are often used interchangeably. That stands for electronic medical record or electronic health record. If you have sought care at a pediatrician's office, a doctor's office, a hospital, and urgent care, you have an electronic medical record. You probably have more than one. Also, HIPAA refers to the Health Insurance Portability and Accountability Act of 1996. It is the regulation that protects your health information, or PHI, protected health information. And there's more information available about that from the CDC. So what I want to talk about for today is who uses EHR data and for what. So in the most kind of obvious sense, individual clinicians use EHR data to make decisions about care for individual patients. Hospitals and hospital systems, this is where I work in Boston, use this data to make decisions about running a business and also care of populations and communities. And then researchers use this data, like me, to do research on populations. And so these are some of the three big uses. And I think the first one is the most obvious, and we don't often think about those second two. So the type of work I do is health services research, and this is research that examines how people get access to care, how much the care costs, and what happens to patients as a result of that care. The goal of health services research is to identify the most effective ways to organize, manage, finance, and deliver high quality care and improve patient safety. So these are some of the data fields that exist in your individual electronic health records that are frequently used in health services research. So things like your age, your sex, race, and ethnicity, those are not available from insurance claims data. Your primary language, often if this data is missing, we use the presence of interpreter services as a proxy. And then zip code and insurance status. So your zip code tells you a lot about your neighborhood characteristics. And then some of these pieces of data are more variable, are more likely to change over time. But there are so many other individual and community level characteristics that impact our health that may or may not be available in the data that researchers are using to make to learn about populations. So we've already talked about race and ethnicity, but also your nationality, the primary language that you speak at home, your faith, your educational level, also the educational level of your neighborhood, socioeconomic status, your housing and your housing environment, your regional, do you live in a rural, a suburban, or an urban area, visible and invisible disability statuses, sexual orientation and gender identity, and age. So I want to give two quick examples about ways in which the data in the electronic medical record can become politicized and become used outside of the context of health. So under a previous presidential administration, there were discussions about the change to the public charge rule. And the public charge rule relates to the extent to which an individual or a family relies on public services like public insurance, food stamps or other food benefits, or other public services, and the ways in which that can be used to determine their eligibility for immigration status into the United States. So people that are deemed to be a public charge can be denied entrance into the United States, and people that are already here and are applying for long-term immigration status, the extent to which they use public services can impact that. There has been a growing trend over the last 5 to 10 years in healthcare to screen for social determinants of health. So these are things like housing instability, food insecurity, electronic medical record. We cannot say that disparities exist. So if we do not collect certain data on populations, that limits our ability to measure the health of those populations and then to develop interventions to promote health equity. One final example I want to give happened recently. There was a Boston-wide talk about the impact of COVID on the city, and clinicians at one of the city hospitals that disproportionately serve communities of color and immigrant communities were trying to respond in real time to the COVID crisis by translating materials, informational materials, into the languages that their community spoke. They realized that a large chunk of their patients were misclassified in the electronic medical record as speaking Portuguese when in fact they spoke Haitian Creole. So these inaccuracies in the data can have very immediate impacts on people's access to information and health. And the one last piece I want to leave you thinking about right now and for our discussion is who controls this data. Everyone on this webinar right now has a degree of digital literacy and probably also health literacy that you probably know how to log in if your healthcare system has a portal to see what information is available about you and to change that information if it doesn't accurately reflect you. The populations at greatest risk for poor access and poor outcomes are the least likely to have that technical literacy and access, and also that health literacy. I'm going to stop there, and I look forward to discussing this more.
Thank you so much, Amy. And now we will hear from Kim O'Neill.
Great, thank you so much. Amy, could you stop sharing?
You got it.
Sorry, it moved all of my screens around. Just have to get everything in the right place. Okay, so my talk in some ways will be similar to or conversant with Amy's. My field of study is the ways that the experiences of people are narrated as a scholar and as a teacher I've been interested in how stories affect audiences, particularly in political and ethical ways. But of course, the flip side of that is that stories in some ways don't affect us. Stories can proliferate without creating a meaningful change. And so one thing that I want to think about today is the relationship between data and the stories of undocumented people and communities. So what I'm going to do is just go through some of the ways that migrant people are sort of datafied, right? Rendered as data, how migrant people are sort of routed into storytelling. Then think about what happens when migrants tell their own stories, and ask a few questions about the ethics of data and the undocumented community. So one thing that is interesting about exploring these questions is that most of our very incomplete data about undocumented immigrants in the United States comes from a very few sources. And you can imagine some of the reasons why, right? Migrants, particularly undocumented migrants, tend to sort of fall through the cracks of data collection due to clandestine travel, inability to access a variety of the official documents that might render you countable, like a driver's license or a social security card. The loss of citizenship rights in a country can make a person unlocatable, right? We saw this problem come up with family separation when the parents of children and the children of parents who were undocumented could not be located due to bad record keeping. And of course, detention centers are designed to make migrants inaccessible in a variety of ways up until the point of deportation. So if we consider all of those factors that make US governmental data about undocumented folks problematic, then you can imagine that the places that data gets collected are fundamentally compromised. So one of the big places is the US Census, and I'm sure you all remember the controversy around whether or not to ask a question about citizenship and legal status on the census. In some ways, those kinds of issues would be really helpful to know, right? Especially for advocates of the undocumented. But, you know, and this goes back to what Amy was saying, that information can also be exploited. There are two sort of key surveys that the US Census offers data about what they call the foreign-born population through the CPS, or Current Population Survey, and the ACS, the American Community Survey. And oh, by the way, really quick, I'm just going to put the live link to this, to these slides in the chat. I'm not going to go through the actual data because this is supposed to be a quick presentation. So I wanted to make it all available for you if you want to sort of click through for yourself and see what I'm talking about. And then, of course, ICE collects its own data and distributes it, particularly in the form of its annual report. And then what's interesting about that is the information from the US Census Bureau and from ICE forms the basis for everybody else's information and statistics, because it's very hard to gather this data. So much of what you'll see from places like Pew, the Migration Policy Institute, actually comes from census data. So that's a problem as well, right? Only having a very few sources and trying to sort of ascertain large scale issues from that very small bit of research. So on this slide, I gave you a couple of examples of the way migrant populations are converted into particularly visual data, which I think is its own interesting issue to interpret. So on the bottom is a really chilling table from the ICE annual report that shows the number of removals, meaning the number of human people forcibly removed from the United States in the years 2018, 2019, and 2020. And CPB stands for Customs and Border Patrol. So, and when you look at the ways that ICE narrates its own sort of relationship to migrants, there's a heavy emphasis on criminality and a complete inattention to the circumstances of migrants, motives for migration, issues that migrants confront, humanitarian and otherwise, along the border, right? None of that is a part of ICE's calculations and therefore doesn't make it into the data. And then the other graph here is from Pew, and it also has a sort of interesting way of imagining how we parse out the documentation status of migrants. Of course, like referring to, you know, some as lawful and some as unauthorized, for example. So one thing that I have been trying to do in my own research is think about how those data sets are sort of channeled into stories. And I'm particularly interested in progressive narratives of what we're calling the immigrant crisis. The conservative anti-immigrant ones, you know, are sort of obvious, right? Like the visions of immigrants as threats to job security, to democracy, to a particular way of life. But I'm interested in sort of progressive or pro-immigrant storytelling, partly because it falls prey to a number of sort of recurring tropes. And what I want to suggest is that those tropes are often well-meaning and perhaps impactful at an individual level. But when they recur over and over again, they turn the human dimensions and lived experiences of individual migrants into stories for sort of white consumption and the, I don't know, the kind of feeling of, or the affective experience of people who do have citizenship rights and who don't actually have much intention of intervening for migrant justice. So I just listed some of the things, and I imagine that what I'm saying will seem very familiar to you as you have encountered these stories yourselves, right? Like almost any piece of progressive journalism that you might look at will contain photo portraits. They're often in black and white, often staring directly at the camera, sort of focused on the face, a close-up or a medium close-up. They usually have an opening gambit, which focuses on the story of one immigrant or two immigrants. Those immigrants are usually members of a family, often children are involved, because journalists assume that the most sympathetic experiences will be the experiences of families. And one issue with that, of course, is that it would seem to suggest, although this is not the purpose, that people who do not migrate in the context of family are unsympathetic, right? Not worth as much counting. And then journalism will sort of supplement those stories with what I'm calling vertiginous statistics, like just sort of mind-blowing numbers that offer a kind of shock value, a sense of the scale of the crisis. There's usually a recounting of a harrowing journey. And again, I do not mean to suggest that these journeys aren't harrowing. They certainly are. It's that the way they are recounted in journalism sort of converts actual experiences into tropes, is part of what I'm interested in here. And then, of course, when migrants arrive, an uncertain welcome by the United States and a kind of tension between what we perceive, and by we, I mean people within US society and sometimes migrants themselves perceive to be the American dream versus a reality that is often very disparate from that dream. So for me, and by the way, the story that I linked here is actually in some ways a very good story. Like, it's long form journalism. It tries to go into the history and dimensions and even global context of transnational migration. So I didn't give you like a bad story. I tried to give you a good one and to show how these tropes appear even in some of the best journalism that we see. And so, oh, sorry, I skipped a slide. One way that I can offer in terms of countering that is migrants telling their own stories, right? When we can somehow stop the sort of mediation of journalism and create space for migrants to tell their own stories. There are, of course, really big problems with that. One, of course, is anonymity. If one is undocumented, then storytelling becomes dangerous. And so you'll see, and I'll just show you really quickly, the website My Immigration Story, for example, has story after story, and they are almost all of them named in ways that would not result in easy identification. Undocumented Stories was a photo exhibit put on by UCLA, and they have an attached video that I put in here for you to look at your own time. Immigrants Rising is a cool set of stories. They are video based and the participants are identified. So one way that undocumented folks have been sort of seizing back the narrative is by coming out as undocumented and telling their own stories. Although again, that requires, amazing bravery in the face of possible deportation. And then advocacy groups like Catholic Charities, for example, offer up stories as well. So my sort of question that I want to throw out about this is, what does it mean to do research, to think about this particular data set, the data set that is accumulating around the undocumented community? I've tried to point out some of the issues with quantitative research, and I also think that the problem sort of filters its way into qualitative research as well, which often relies on quantitative data. And how can we sort of give back as we engage in this research as teachers and as activists? So yeah, I'm excited to talk this through. Thanks, everybody.
Thank you so much, Kim. And so now we'll turn to some questions. I think one of which dovetails very well with what you were just saying, Kim, actually. So maybe I'll go backwards from how I plan to do the questions, because I think this is one we should really take on. So gathering data is an overwhelmingly extractive process in general. How do you see scholarship and teaching giving back, as you were saying, repairing relationships, improving community through the use of such data, or involving such data?
So I can speak to the realm of health research. So I think part of it is really working on health literacy and empowering patients and communities to understand how their information becomes data and the ways in which it's used. A lot of academic medical centers have academic community partnerships. And I think to the extent that healthcare systems can partner with community-based organizations that have those deep ties, that have been doing the work, rather than coming in and trying to do a top-down approach, I think if they can humble themselves to not be the experts and to take a more community engaged approach. I think a lot of work can be done that way. I think that there needs to be a lot more dialogue about the concerns that communities have and the questions that they would like answered and the health issues they would like addressed, rather than it being the kind of top-down academic researcher format.
Can I just follow up by asking, have you met with any communities or heard from them what kind of information they would be looking for, what they might want to do with this data?
Yeah, so at Tufts Medical Center, we have a community academic partnership called ADAPT, which stands for Addressing Disparities in Asian Populations Through Translational Research. So Boston has the country's third largest Chinatown after New York and San Francisco, and Tufts Medical Center sits directly in Chinatown. So we do a lot of work with the local Chinatown and Asian communities. And so one issue that is always at the forefront of theirs and is not, you know, the clinicians want to focus on rates of smoking, which are very high, and the community wants to focus on mental health and problem gambling. So there's been a lot of work to try and there's often a mismatch between the community priorities and the strengths of the academic medical center. So I think there's more work that has to be done to build up the resources that need to exist to meet the community's needs and priorities.
Fantastic. And Kim, would you like to respond to that one too?
Yeah, sure. So I guess I'm going to be a little bit blunt. I think that often scholars kid themselves that our research is a good in and of itself. That sort of noticing and accounting for social problems is all we have to do. And I even think that we kid ourselves, you know, those of us who are really dedicated to teaching, that if we just transmit that knowledge that we have gained to students, then that is all we have to do. And one thing that I have been considering for myself is, you know, so what I have found in my research is that these tropes that I'm discussing have recurred in narrative after narrative for actually hundreds of years, right? They have old origins, and over again, they don't seem to have the effect that is hoped for. So what I've been thinking about for myself is part of the issue is really thinking differently about the efficacy of narratives and trying to offer up potential solutions or new ideas. I would suggest that qualitative and quantitative researchers need to work together more because they notice different things. And, you know, as Amy suggested, we also need to be accountable to the very people who we presume to be studying. So the other thing that happens, particularly in the humanities, is that scholars manage to distance themselves from the people behind the data, right? So like, I mean, I live in Connecticut, and it is easy for me to write a whole article about undocumented people without ever having spoken to an undocumented person about it. Sociology tends to work differently and more in direct contact with people, or at least, you know, some of my favorite sociologists work that way. But I do think we need to rethink that practice. Humanists in particular have a way of fetishizing the text. And what is clear to me is that a proliferation of text is not solving the fundamental problem, which is that the US government, and that is the context that I study in particular. So this is a problem with governments all around the world, but the US government has been engaging in human rights violations with respect to migrants for a very long time, and they are maybe worsening in some ways, but they are certainly not getting better, and that demands a different approach from all of us, and particularly from humanists.
Yeah, Kim, I think your point, I think some of the best researchers in fields do connect with the populations, but I think that is not the norm. And it is not, necessarily, it doesn't get the disciplinary support and mandate that it should. I can say, in speaking to the divide between qualitative and quantitative data, one of the things that I note, and to get into the ethics of teaching, I teach health services research to master's students, and those are generally clinicians who have finished their clinical training and are coming back to get either a certificate or a master's or a PhD in research. And their training has been very positivist and very didactic. And I think that there's a strength to that, right? Like doctors and clinicians need to have a lot of like knowledge in their head. However, there is this incredibly positivist notion. And when I say that, what I mean is that this quantitative data that exists is somehow true and valid in a way that qualitative is not, that the quantitative is accurately reflects the world in a very, highly valid way, and that qualitative is subjective and messy and fuzzy and not objective, implying, and is subjective, implying that the quantitative data is like just completely objective. And I think that's one of the big challenges, is when you abstract this data, for example, from the electronic medical record, and you look at a patient's race or ethnicity, it is not clear. Like, there are best practices around this, collecting this data, but it is not clear whether the patient filled out a form that they understood in a language that was accessible to them to self-identify, or if someone at a reception desk clicked the box for them. And then that data gets treated as though it is fact and is used to solicit funding and make decisions about interventions and all of these other things, without really thinking about the quality of that data.
Kim, do you want to respond to that with regard to the subjectivity, objectivity in the humanities as well, in the qualitative, quantitative relationship?
Yeah, sure. My vigorous nodding, I think, indicates agreement. And I think, so humanists, to my mind, are really just starting, maybe in the last 10 or 15 years, which is recent for the humanities, to think quantitatively. Some fields within the humanities, like, so writing studies within the discipline of English, does much more sort of quantitative work and more ethnographic work than anybody else in my, sort of my general area. But I think it's a problem. It's a problem for interdisciplinary work, right? That, like, the humanists have a tendency to throw up our hands and sort of say, well, it's all subjective. And the quantitative researchers, I think, take a variety of approaches to this problem. But I do think that I guess maybe one issue is that qualitative researchers, and not necessarily even just humanists, but social scientists as well, who I know who identify as qualitative researchers, are so busy defending the practice as legitimate that we don't really make time to establish a shared ethics. And maybe that's a place for a conversation to begin, and I think a place a place that humanists could really be of use is intervening with, the quantitative folks and saying, like, you have been thinking about ethics in these ways and they are valid and reasonable, but what about these additional ways, right? I don't know, for me, thinking, and I don't mean ethics in a kind of vague philosophical way. I mean, trying to attend really directly to the potential harm that we do as researchers, and also ideally giving back, contributing to the justice that we hope to see in the world.
So let me push us on one area of that conversation. I'd like to ask you what makes data in your areas of study. Are there any conversations that are challenging this term, the way it's constructed, the way it's used? And if so, what are they like? And what are your thoughts on data as a term?
So I can give one concrete example about a conversation that's happening about data and measurement in the field of medicine right now. But I am not a clinician, and so I'm not an expert on this topic. But so there's been a big push with the recent resurgence of the Black Lives Matter movement to think about ways in which structural racism is part and parcel of the field of medicine. And again, the things that we know and we think that we measure objectively, many of the different disciplines in medicine have their roots in, the examination and, torture of enslaved populations. So, for example, in the field of nephrology right now, the measure of kidney function, the kind of gold standard, is something called GFR, and it stands for globular filtration rate or something. I don't know, you can Google it. There is a piece of that equation that accounts for race, and it was developed by a known eugenicist. And so by putting race into that equation, the kidney functioning of Blacks and African Americans can be overestimated compared to their white counterparts. And that has very real consequences for things like status on a kidney transplant recipient list. There was an excellent episode of Grey's Anatomy about it recently. But this is something that, is being talked about in hospitals, in medical school classrooms, because this is the type of data, right? How a kidney functions that we think is objective, that has just gone on for decades and decades unquestioned. And I think it is very much the activism of medical students, particularly BIPOC medical students, that have been really active in challenging a lot of the racist underpinnings of the field of medical knowledge. And that needs to happen at like the deepest roots in terms of who gets to decide what is knowledge and what it is we know about the human body.
Kim?
Yeah, so for my field, there are lots of ways to answer this question. I think the quickest way is to say that for scholars in literary studies, texts are data. And that has, I think, at its heart, a radical idea, which is that any kind of text matters, right? So as opposed to this idea that there is objective data and then there are stories, a humanist centers the story, even if the story is fictional, even if the story is a poem. For me, I'm really interested in what my field calls ephemera. So like flyers, brochures, museum displays that change out, things that come for a little while and then sort of disappear. I am interested in them because they they always seek to be of the moment. And we forget as a society to value them a lot of the time, but they often sort of speak, I think, profound political truths that get ignored. But what's interesting about that is that, you know, even though my field purports to value the text, it is always the case that certain kinds of texts are more valuable than others, and that texts, especially published texts, are more valuable than other forms of storytelling. So historically, we have really struggled with that, right? Like with decentering the cisgender heterosexual white men who dominated, you know, our sort of published canon for such a long time, and still do, right? And when we think about the internet, I will say sort of broadly, it can be a much more egalitarian space to find those stories. But of course, the problem that I am encountering is that there are so many stories, and they are separated from the storytellers, right? So there are these like anonymized names with these paragraphs that are like a little piece of what is actually a very big story. Or they are stories by journalists that feature, you know, tiny bits of the stories of many, many migrants. And so I think one thing that, I don't want to speak for all humanists, but what I as a humanist try to do is to find patterns within the data as I can find it. But then of course, at every turn I am encountering the limits of that data.
To add on to Kim's point about the internet and the kind of democratization of knowledge and of data creation, I will say in the field of medical sociology, I think it's been a tremendous tool for people, especially people who have rarer conditions or who have, you know, diseases that are less well understood by the medical establishment, as a way to connect, you know, nationally and internationally, and turn their own lived experiences into data that is very much at odds with the kind of clinical trial version of data that is the gold standard in medicine and in you know, academic knowledge about diseases. So I think that there are tremendous opportunities there for people to address health issues for individuals and communities from a more grassroots perspective.
Thank you both. There's a lot there that I would still love to ask about, but I would also like to open the floor to our audience to ask questions. And you all are welcome to ask questions in the chat or to unmute and ask questions, whatever you are most comfortable with. Raise your hand too, also that I'm keeping an eye on everything. So. Okay, while folks are thinking, let me just follow up briefly on something that you've both been talking about a bit here, but how do you approach anonymity and concerns around the privacy of personal information in your research? Especially when we're talking about, you know, the big, wonderful and or big bad of the internet, right? How does that factor into the work that you're doing and your thinking around it?
I will say that I think true anonymity is it's frequently impossible, especially when we think about digital fingerprints and things that are way beyond my knowledge. But if someone wanted to track down an IP address, they, you know, that doesn't take too much sleuthing. And so we really try and in my work, most of the focus is on confidentiality. And it is, you know, I think about the kind of ethics of this in that frequently when we're using data from the electronic medical record, we're doing it retrospectively, not prospectively, so going back instead of going forward. And we don't get individual consent because we say that's not feasible. And there are, you know, human subjects protections in there. There are extra protections around information that we deem highly sensitive. So things like psychiatric records, HIV status are two ones that come to mind immediately. But I think it is a challenge in terms of thinking about what does informed consent mean when we're doing research on, you know, using this data that exists. And then, you know, when it comes to the internet, the ethics of taking data that people have created in some form about themselves and put out there, but didn't put out there for the sake of it being data, and what it means to treat that as data. I think that that is a challenge.
It's so interesting that you talk about IP address. That is something that definitely didn't occur to me. Yeah, one benefit of focusing on texts is that they are sort of pre-anonymized. You know, if I use the name that was given in a paragraph that is posted on a website, I am sort of not in violation technically of any you know, standard of anonymity. It becomes much more tricky, right, if we start to do what I'm asking, which is to ask or to demand that humanists engage directly with the people they want to research. Many of us are not trained in the sort of ethical standards of you know, doing qualitative research, let alone, you know, there are all kinds of sort of practical issues around, you know, like what order you put survey questions in and stuff like that, that like no one has ever, I have never learned about in a systematic way. I only hear about it from people who actually do that sort of thing. So yeah, that is certainly an issue. I think I even have wondered when I look at and talk about videos that are made by people who identify themselves as undocumented, but they expect their audience to be like this, you know, and if so many researchers start looking at them and talking about them and their audience expands, does that put an undocumented person in the spotlight of ICE in a, you know, in a different way? And yeah, that question about sort of the security of research, especially with Google Scholar, right? Like any ICE agent presumably could go into Google Scholar and start looking up citations. Yeah, it's a profound issue.
I don't want to give anyone any ideas, but yeah. It's a whole source in and of itself, isn't it? Let's see, would we like to take that further? Let me just make sure we don't have any questions. No questions in the chat yet. Okay, no hands raised. To talk about, should there even be a best practices or an ethics? Is it possible to even do that? And I sometimes I don't like asking these questions because they're impossible questions, but you know, like, is there a way to really capture a good standard, a proper standard for any of this? And if there is, how would you then communicate that as an instructor, as a professor?
I think so much about power. And in terms of, and so even about who is determining what is ethical, who gets to decide what is ethical, and how, especially vis-a-vis, so I am a cisgendered white woman. I want to do research with minoritized communities to improve their access to care. And even with my best intentions, if I'm doing what I consider to be ethical and the standards that my professional association, my employer holds me to in terms of ethics, does that meet the population's definition of being treated ethically? And I think it's something that the academy needs to wrestle with more. And it is starting to be a call to account for. I think, so when I was doing my pre-doctoral work, I was in New York City. I worked at an HIV research center, and we did a lot of recruitment from bars. And so here we were as researchers intervening on people's nights out. They were going out for fun and for leisure, and there would be, minimum 4 or 5 different research teams from the different universities and stuff there trying to recruit people. And yes, it's informed consent on their part. They can choose not to, but it wasn't their choice to have us in their space. And that's not a reasonable expectation when you go to a bar or a nightclub that researchers will be there recruiting for you. It was for gay men at that time, because it was just like, okay, here's another research study. And there's a lot of talk about this in sociology with unhoused populations and transient populations. But I think that it would be nice to have more community-derived standards of ethics that were specific to the populations of study vis-a-vis the researchers.
Kim?
Yeah. So I'm torn between saying that, it's we have to try, right? That it's important not to throw our hands up, especially, there's this fundamental problem of being, a member of an overrepresented group, right? Like white and cisgender, because we do not want to be white saviors, and nor do we want to, and by we I mean very personally me at this point, nor do I want to throw my hands up and say, this is not my problem and I can't possibly offer anything to it, right? And so I think it's important at every turn to ask the question, to be as sure as you can that you are not doing harm, first and foremost. And I think I'm doing something really cool in the spring. I'm teaching a class that is partly for students at my university and partly for members of the community who just want to take it. And I think moments like that are crucial. And when I think about, so for me, what's very important to me is that I am not just a scholar, I am a teacher, and I am an activist, or I am always aspiring to be an activist. I don't, on any particular day, I'm not sure one gets to just sit down and call themselves an activist, but trying to live at that nexus, I think, is really crucial. And I'm hoping that, part of what is really needed here is creative thinking about the relationship between universities and the communities around them, to stop thinking of ourselves as people who study the world and to start thinking of ourselves as embedded in and accountable to our communities, and that requires different things of us, so there's in New Haven, there's a big group of people who are trying to hold Yale accountable for its position in the community. And Quinnipiac is funny because we're like, smaller and sort of tucked into a smaller town than Yale. But the demand on us is the same, right? That like, if you are occupying this land, formerly indigenous land that is now not even sort of taxable, not even giving back in fiscal ways to the community, then you have a debt that needs to be paid. And so I think, keeping that in mind and operating at the nexus of someone who seeks justice and someone who teaches others and someone who is learning oneself, I think is maybe the best we can do.
Wonderful. Thank you both so much. We are at time. I don't want to keep you any longer because I know you're both very busy. Thank you so much for accepting our invitation to present and discuss today. I hope we can have you back with the UT community again in the future. I sincerely appreciate your time and everything that you shared with us. You're doing amazing work. Thank you, Amy, and thank you, Kim.
Thank you for having me.
Thank you so much, Del. Thanks, everybody.
Bye,
Thank
everyone.
you all for attending.
Take care.
Have a good one.